Welcome to Dental Sleep in 5, Episode 11. Should you practice dental sleep medicine in a COVID world? No vested interest in any appliance, device, or technology. Maintain a sleep disorders dentistry practice, conduct research, provide educational programs. Our facility is accredited by the AADSM, and the facility and all programs follow AADSM guidelines. So you're interested in offering oral appliances to manage OSA but are concerned about COVID-19 issues. Should you be concerned? Hell no. In fact, you don't produce aerosols in dental sleep medicine, so you're practicing dentistry in a very safe environment. How can I say this as simply as possible? In a COVID world, dental sleep medicine is a valuable, necessary, and safe procedure. I'm actually very thankful to be able to provide such a valuable service in a safest possible dental environment. Some considerations. Approximately 1 billion people worldwide have obstructive sleep apnea, and greater than 85% of them are undiagnosed. We know that CPAP works. However, between 50 and 60% of patients will wear CPAP long term. Regarding oral appliances, much higher compliance rate of about 90%, but about a third of the time we have some residual apnea left over. Now, when we look at mean disease alleviation, oral appliances and CPAP rate quite comparably with regards to reduction of symptoms, both measured subjectively and objectively. This is thought to be because of the longer compliance or higher compliance that patients experience with oral appliances versus CPAP. However, for those patients that we have residual apnea, what we look to do is add adjunctive therapies along with the appliance to take them the rest of the way. So there's the snorers. If about 1 billion people in the world have obstructive sleep apnea, many multiples of this snore. Cost to individuals, quality of life. Longevity of life. Obstructive sleep apnea unmanaged will take you out earlier. And cost to society. Lost productivity, comorbid diseases, workplace accidents, motor vehicle accidents. Unmanaged OSA is linked to a higher risk of serious complications from COVID-19. According to the CDC, fatality rate for patients with other health problems is 6 to 10.5% versus patients who are otherwise healthy is 0.9%. Now, when we compare PAP to oral appliances in a COVID world, oral appliance therapy reduces the likelihood of contaminating surroundings with virus-laden aerosol caused by mask leaks. Also, oral appliances are much easier to disinfect than CPAP. According to the American Academy of Dental Sleep Medicine, during this pandemic, it is reasonable to assume that patients would prefer as therapy an oral appliance because it does not increase risk of COVID-19 transmission. A further quote to that guidance, oral appliance therapy is an effective treatment for OSA without increased risk for transmitting COVID-19. Patients who prefer oral appliance therapy may be more likely to adhere to treatment if they are confident that their therapy is not putting those in the household at risk for COVID-19 transmission. Dental sleep medicine is here to stay. Why? Because sleep medicine needs dental sleep medicine, and because your patients need dental sleep medicine. For those of you that are not involved, is it time you get involved? So what's the take-home message of this session? How do you spell opportunity? DENTALSLEEPMEDICINE. Thank you and sweet dreams.